Good morning.
Good morning.
Hello, I am Christy Chin. I'm pleased to be your moderator, and we are experiencing a little technical difficulty with our other speaker, Chet, and so he'll be joining us as soon as he can. But I wanted to warmly welcome everyone. Good morning to those of you on the West Coast. Good afternoon to, I saw people all over the country. And even good evening to those of you in India and Africa. We appreciate that you're joining us in this, again, virtual Global Philanthropy Forum. I serve proudly on the board of World Affairs, and as Philip Yun has mentioned many times, he is focusing the organization in new directions, focused on insights, which we hope you're getting in these conversations, action, that we can take action together. And our discussion today is about actions that two foundations have made, and hopefully these inspire us to come together on the third point, which is community, to come together as a community to address the vital challenges that are facing our systems and the opportunity to create healthy communities. And that's been very broadly defined. So I'm thrilled to be here. I've been a long-term participant at GPF. It's a really unique place for us to come together as philanthropists and people of action. So I look forward to the conversation and hope that you'll post some questions in the chat as we move forward. We have an incredible group of two incredible leaders today, and I'm sure Chet will be able to get the technology working, or at least join us by phone. So as soon as he comes in, we'll just have him jump right into the conversation. But it's my pleasure to welcome JUDY MONROE, who is the president and CEO of the CDC Foundation. We all know the CDC much better than we did 2 years ago. She's had a long career there, and she was a deputy director for the U.S. Center of Disease Control and Prevention. And previously, she had served as the Office of State, Tribal, Local, and Territorial Support. She joins us today from Indiana, where she was actually the state health officer, and she'll tell you more about why she's in Indiana. JUDY has an incredible history. Unfortunately, she's not new to pandemics, and so she's been on the front lines of Zika, of Ebola, and even H1N1 and that pandemic. So we look forward to hearing more from her. Even though Chet's not here yet, I will introduce him, and then we'll just have him jump in. Chet comes to us from the Bay Area. He's in the East Bay now. He has 25 years of experience working in public and private sectors. He's currently the president and CEO of the Sierra Health Foundation, and he was recently named a fellow of the National Academy of Public Administration. Before becoming the CEO and president of Sierra, he spent 5 years in the Alameda County of Social Services, and he was credited there with transforming the child welfare system into a national model. We're thrilled to have him joining us, and he also has served at the Rockefeller Foundation in New York and managed the West Coast office. So with that, I will say that I've had the pleasure of working at three foundations. I started at Skoll, then was at Hewlett, and wrapped up at Draper Richards Kaplan Foundation. And what I can tell you is every foundation is pretty unique. And so as a start off, I thought we would have JUDY introduce the CDC Foundation, tell us a little bit about its history, and then we'll move on to hopefully hearing from Chet.
Great. Well, Christy, it's really terrific to be with you and to join everybody today and to introduce the CDC Foundation for those that are not aware of it. I love the topic that we're covering today because it's really dear to my heart because it's kind of telling the story of the CDC Foundation. We were created by Congress, so we are a unique foundation. Not too many foundations have been created by Congress. Back in the 90s, to be able to extend the life-saving work of CDC and with a mission to support public health. And so we forge public-private partnerships to be able to do this work and to protect public health. I think for the audience too, when we talk about public health, just to define that a little bit, I'm talking about the science of protecting populations at large as compared to healthcare, where we're really focusing on one person at a time, one individual health. And so since our creation 26 years ago, the CDC Foundation's been pretty busy. We have a broad mandate. As you can see, we've launched over 1,200 programs during that time. We're not an endowed foundation, so we've mobilized over $1.6 billion over those years, and we've had programs in 160 countries. So we do both global work as well as domestic here in the United States. The foundation, I love the history of the foundation because we were created out of the need that several CDC directors saw, former CDC directors, particularly Bill Foege. And everyone should know the story of Dr. Bill Foege. He was really the mastermind behind the final strategy to eradicate smallpox, and it's the only disease we've ever eradicated on Earth. And he learned through that, government obviously has a lot of strength and we need government, but government has challenges. The same is true for philanthropy and private sector. And he saw that when they came together and when you were able to mobilize, if you think about it, the total community coming together, you could better address challenges, and particularly big challenges like we're facing today with the pandemic, but to eradicate a disease like smallpox. Our tagline at the foundation is actually "Together, our impact is greater." So we really, it's more than a tagline for us at the foundation. So again, we've done a variety of things. We work in infectious diseases, as an example. Meningitis in Africa is one of the areas that we've done a lot of work in. We've worked on chronic diseases like tobacco use, and then emergencies, which you mentioned. The foundation's been involved in a number of emergencies. I started at the foundation the day that Zika was declared a public health emergency of international concern. So I was like, it was no downtime, no time to get oriented, just go right to work. But that's the way public health emergencies are. One of the things, to give an idea, give you a little flavor of the kind of work we do, just a couple of weeks ago, there was the historic announcement with the fight against malaria that now the World Health Organization is recommending the broad deployment of the world's very first malaria vaccine. And this will reduce childhood illness and deaths from malaria in sub-Saharan Africa and other regions with moderate to high malaria transmission. The World Health Organization's recommendation for this broader use was made possible because of this unprecedented collaboration starting in 2018 that included the CDC Foundation, I'm happy to say, but a number of in-country and international partners in Ghana, Kenya, and Malawi to really prove whether this should go full scale, like the wider recommendation now. So it was that data and evidence that was generated by the team to evaluate the impact of the vaccine and looking particularly at safety and effectiveness to prevent the disease. I'm happy to say that recommendation is out now. And this really could save tens of thousands of lives annually. And then the last thing I'll just mention is just how important coalitions are in public health. And we do a lot of coalition building at the CDC Foundation. We're involved in a lot. But think about the polio vaccine as an example and the number of lives saved. The fact that we have success of vaccines like that, you've got to get jabs in arms. You've got to have coalitions to build up not just the development, but then the getting everybody vaccinated. So think about history where public resources came together for the polio vaccine, private funds, the March of Dimes. I mean, that was really community building, right? Universities and others. So those are a few thoughts to start off.
Yeah, I can't wait for Chet to join us and share a little bit about what they've been doing with community ambassadors and how they've been leveraging, the cultural connections that people have in their own community to help get those vaccines distributed and shots in arms, as you said. So the CDC Foundation has to be on the front lines of COVID. And I'm wondering if you would just share a little bit about the CDC Foundation's response to COVID, and what were some of the lessons learned, tips that you could share with our listeners about how they can be more collaborative to have greater impact.
Yeah, thanks for the question. So we have quite a story to tell, as you can imagine, with a pandemic, and you're the CDC Foundation to support CDC. we were actually the first nonprofit in the United States to activate our emergency response. And we activated on January 27th, 2020, just a few days after CDC activated their Emergency Operations Center. So back in January of 2020, folks weren't necessarily all that concerned about this virus, right? We were beginning to just hear about this novel virus. That actually speaks to some of the lessons that we've learned in the past that we applied. And that was, we didn't hesitate. We knew this could be big. We didn't know how big. But that's why we activated really fast and got out in front of it. And that's a message I would give numerous times to folks is we shouldn't be hesitating. We've got to take action. And so in our case, we went to work socializing the idea that we were activated, that this could be big. We were very fortunate to raise significant funding to help us do multi-sectoral work, and we received funding. I have to tell you, one of my fondest stories about this were the children that saw CDC in the news, learned about the CDC Foundation, and we literally had children that were like selling lemonade or artwork or doing and that spoke to me about the full community, right? We were all in this, all the way from the children to individuals, philanthropy, government, everyone.
Judy, I don't want to interrupt your flow, but it speaks to a question that we talked about when we prepared, which is we all pay our taxes. So why does the CDC Foundation need additional funds? And so could you just speak to that for a moment while you're talking about the lemonade stands and activating?
Yeah, no, I mean, it's a terrific question, right? Well, so what happens is a lot of times, and folks don't understand this, you have an emergency, but government funding is earmarked, right? It's not like CDC has all this flexible funding or other government agencies. They need Congress to act on the federal level and at the state level, many times too, if you're mobilizing state level funding. And that takes time. That doesn't happen as quickly. So what we bring as the CDC Foundation is that nimbleness and that real sense of urgency that philanthropy is really great at. Philanthropy fills a gap, and we're like fire starters. And we've got lots of examples during the pandemic where we were the ones that were able to get out quickly. I'll give you an example. We had a call from there was a community in Richmond, Virginia. It was a Latino community, and they had been really hit hard early in the pandemic. They were all on the verge of homelessness, literally a whole community on the verge of homelessness. I got a call. I had folks from the state, the local, saying, "Can the foundation help? We don't have the resources to get this started." CDC was saying, "Look, they really need help." We made a funding decision like within an hour, and we were able to support the funding. We brought in technical assistance. We built coalition. We challenged them to rally more funding, and then government funding followed later. And that's a common story when emergencies.
Right, and that was actually in the opening panel. The Kresge Foundation and San Francisco Foundation cited that as one of the things that foundations have done differently during COVID, which is act more quickly, and having those mechanisms in place, that you can reach out to your board, that you can be flexible, and that there's additional funds. You're not endowed, but many foundations have an endowment. And so is this a moment in time? I mean, this past year, I've wondered often, if this isn't your moment in time to reach into your endowment, when is? I mean, epic, a health crisis. We've had challenges to democracy. We've had floods here in California, fires. And so calls for social justice. I mean, I don't know, as you said, we're the fire starters, and can be as foundation leaders. And so recognizing this moment in time and stepping up. So congratulations. I interrupted you. So let's get you back to, you were starting to, the foundation made a decision within an hour to act, and you were the first to be addressing the COVID challenge in the United States or globally. So do you want to just get back to that since I interrupted you?
Yeah, well, we did a number of things during the pandemic. So some of our work that we were able to do, we supported 93 different jurisdictions throughout the pandemic, including states, territories, various countries that needed support. And we ended up, we're up to about 300 distinct programs that we were able to help support during the pandemic, wide range. So if you go back, if you'll remember the early part of the pandemic, it was personal protective equipment that folks needed. And because of our relationship around the world, we were able to help supply personal protective equipment to frontline workers, essential workers, and we were able to source that from China and get really high quality, personal protective equipment. So that was early on, and then moving on, there was research that needed to be done. This is something that everybody needs to think about as well. You've got a novel virus. We have no idea, as an example, how it's going to impact pregnant women or infants, or what about the medical care? I mean, this is new. So treatments that you might have worked in other viruses may not work because we don't know enough about this virus. We ended up helping to fund 17 research studies. And many of those, we were the catalytic funding. We were the first funder, and then other funders followed because they, and it's helpful to have, I guess, in this case, CDC in your name because it's.
Oh, yeah, I was going to say you have a lot of credibility, you know.
So
to be and then the CDC directors started your foundation. I assume they're still involved. So you knew exactly who you needed to reach out to, what the scope of the research needed to be. What were the timelines for the research? I'm just curious because, as you said, it was an urgent problem, but we knew very little about it.
Yeah, some of these, as an example, like the pregnancy registry, that needed to start right away. And so the researchers were ready to go. In fact, the lead, most of these were multi-site research studies, but it was at the UC San Francisco. The researchers were ready to go. They came to us. Again, we made our funding decision very quickly because we knew if they needed that to begin to gather the data, get all the information needed. Another example, we funded a project in New York State that there was a very wise laboratorian there that said, hey, you know what, we're getting blood spots on every newborn because of the newborn screening. And we have the capability to test those blood spots for antibodies to this new virus. And so now they're going to have 2 years of data for every newborn in the state of New York because we kickstarted that and made a really fast funding decision because we saw the wisdom in what they were trying to do. There's some other multi-state. Some of the research is still ongoing for the clinical care, but there were changes in clinical care based on some of these studies early on for better outcomes.
Yeah,
so
that is incredible. Just
incredible. You don't have time to hesitate.
And can you just tell us a little bit about how, I'm just curious with your work in action, and so many of us are in foundations and working. I'm just curious, how did you have the mechanisms in place to make these decisions so quickly, and then to activate your connections with beyond in the board, the advisory group? Can you just speak to that? Sort of how were you the fire starter? How did you get approval quickly? What are those mechanisms in place, and how do you think about continuing those into the future?
Right. So we take emergency response very seriously and have learned those lessons over the years. That's not the time to wait 3 months for the board to meet, those types of things. So we've put in place within the foundation, when we activate for an emergency, the first thing I do is actually go to the board and we get approval from the board to activate. And then once we're activated, that then opens up that ability for us to move really fast. If funding is coming in, particularly unrestricted funding for the emergency at large. And then we're in communication with CDC daily, many times a day when it's an emergency. So CDC has that knowledge on the ground. And so that certainly gives us great confidence in our ability to make wise decisions, funding decisions. And then we work with numerous partners. I mean, I can't even begin to tell you, as an example, one of the things that we were asked to do was to help surge staffing in health departments. So we hired over 1,000 staff that were embedded literally in every state health department. So that was another mechanism. We were getting, so we had our antennae, I guess, all the way to the ground in communities that we were helping support in health departments at CDC, and then many partners beyond that as well. So
that's great. And because of your background as a state health officer, you probably have connections and relationships and knowledge that could be particularly helpful. Can you now just share, what are you doing? What brings you back to Indiana? And what will you be doing for the rest of the day? Because I think it would be of interest to our participants.
Yeah, so I'm joining you from the Indiana State Museum today. This is where they found a room for me to be able to do our conference. But I was Governor Holcomb, the current governor in Indiana, decided that, especially, in the aftermath of, we're still in the pandemic, so in the midst of the pandemic, but also because of just, historical health rankings and so forth, decided that modernizing public health needed a hard look for the state of Indiana. And this is a question that everyone's asking now. I mean, I think worldwide we're saying, how do we strengthen our public health system? So this is a unique opportunity here in the state of Indiana. And so I was invited to co-chair of the governor's public health commission. So I've been appointed by the governor. And at 1:00 today here Eastern time, I'll be chairing the second meeting of the commission. And today we're going to focus on workforce for public health in the state of Indiana.
That's
we'll be
great.
focusing on things like data modernization, financing, and structure, and so forth.
Yeah, I mean, the amount of information that we currently have access to, and then how to not only get the information, analyze it, and then act in a way that's appropriate. I think many of us have read John Lewis's book or other books, or Michael Lewis, its book about the pandemic and the role that the health officers played within the states, and also the role that the governors have played in public health. So it's really a time of incredible transformation that there are all these different individuals, both government officials, philanthropists, who can be activated and be leaders around a system. One of the groups that, or one of the partners that I think you work with quite often that we haven't talked about are the community-based organizations. And I wondered if you could speak a little bit more to how does the CDC Foundation, you've a nice calling card, and maybe you can work with some of the grassroots organizations around the world. So would you speak to that, those partnerships?
Yeah, thanks so much. So we have done some work in the past, with community-based organizations, certainly, but during the pandemic, we really have taken this to scale, and we want to see going forward, we really need our community-based organizations connected to health departments, connected to public health. I think we've all seen that. That really was the model during HIV, where the community-based organizations were quite connected, and then we lost that somewhere along the line. So for the CDC Foundation's part, particularly around those trusted voices for vaccine confidence, or to be able to even transport, what in communities that folks have transportation to get their vaccines, that type of thing. And so we were able, both through some federal funding, because we also can compete and receive federal funding as an independent nonprofit, and then through private funding. And a big shout out to philanthropy, because we've had a number of philanthropies that have supported us in this. And then we in turn have funded over 180 community-based organizations across the nation. So we've got quite a map. It's continuing to grow because we received some additional funding from other philanthropies. And then what we've done with the CBOs is we've given them technical support. We do a monthly webinar. We bring CDC experts on to talk to them directly. That we're making those connections. And it's been a marvelous experience. The other thing is we've had an eye toward building their capacity. So one example is we received some free ad credits. Google came in with some ad credits as an example. And what we learned was the health departments couldn't use them. We wanted to give the ad credits to the CDOs, but their website wasn't set up right, or they needed additional help. And so that's been really fantastic to be able to help them build their capacity, so that going forward, they can be recipients of some of these other types of donations that may come from private sector or philanthropy.
Yeah, no, that's great. And one of the frames for this conversation and this conference has been all around health equity. And I know that I'm sorry that Chet can't join us, because that's really the social determinants of health is a big portion of how Sierra Health Foundation addresses its work. And so I'm hopeful that he'll chime in and join us shortly. But could you speak to just how you think about the CDC's work with equity lens?
Yeah. And again, that's a topic that we've always been concerned about. But during the pandemic, I mean, this has just been, there's a silver lining, I think, to any crisis. And one of them is the intentional work that's being done now around equity in ways that maybe we haven't seen so robustly. And so in our case, we saw the need, we were leaning in, but we ended up actually creating a Chief Health Equity and Strategy Officer. So we've had Dr. Lauren Smith on in that position with us for over a year now. She came on about a year ago. And we've been looking at equity through a number of lenses. We've done through the pandemic, we've worked with a number of communities that are at risk and have provided on the ground support. We've worked with a number of historically Black colleges and universities. One I would call out particularly, we've worked with Daniel Dawes at the Morehouse School of Medicine at the Center for Health Leadership. And we were one of the early funders to help support a health equity data tracker that they've created there. And that's being used widely now. So as we thought about equity, it's all the way from, are we collecting the right data? We've also worked with CDC on looking at their surveillance systems and what questions are being asked, and are they getting the right data so that we understand the problems and where the opportunities are, all the way to looking at policies. And even internally, we're taking a hard look at like who we fund, like vendors. So, when we have funding coming in, are we assuring that we're being equitable in the opportunities for minority-owned businesses or small businesses or what have you. So we've taken it's a journey. Can I tell you? I think the health equity is quite a journey.
It is quite a journey. I think every organization has looked carefully at what they can do. Did I hear another voice, or was it just an echo? I just want to make sure if Chet joins us, I actually see him. But not yet. Okay. It's too bad, because I think that so many of the examples that Chet had planned to share with us have to do with the cultural brokers that would be able to bridge some of those gaps. And trust is such an important piece, especially when you're dealing with people's health. And so these vital systems that are so important to the public health are also dependent on building trust around different communities. One of the things that you mentioned earlier was that we have more people maybe entering the public health field. So what I'd like to do before we open it up for questions is just get some of your advice or calls to action for the folks on this call, and then we'll open it up for questions. And I see one has already come in, which is great. Mm-hmm.
Oh, good. Getting some questions now.
Yeah.
Do we want to go to that, or do you wanted me to?
Why don't you? I'd love it. We talked in advance about maybe sharing some calls to action. What do you think? If we caught up a year from now, what would you like people to have done differently or think about? I mean, one of the things I would just share as a reflection is, I think your foundation is set up to respond to emergencies. Most foundations are not, but having a plan in place with a foundation to say, hey, if an emergency hits, what are the mechanisms by which we would authorize emergency use? I can say that serving on the boards of organizations like Food Forward and Benetech, getting the emergency unrestricted money to continue to do the work during the time of COVID was incredibly helpful. And I know many foundations did that. So for me, that's one of the calls to action, is that every foundation should listen to what you just said, which is, get your board together within an hour, approve something, make it happen, get more money to those that you already know are doing good work, and then think about how you're going to do your work differently. But with that, I'll turn it over to you to let people know what your advice might be, what your calls to action might be.
Yeah. Well, first of all, just a comment on folks going, so many applicants to the schools of public health. I mean, the good news is hopefully we'll have a lot more folks trained in public health, who can help with some of this plans for emergency and thinking about public health. But I think when we think about calls to action, I would summarize it by, I'd ask everyone to think and act both locally and globally. And I say that here we are coming out of this, hopefully we'll come out of the pandemic, but we've still got a long ways to go. If this virus has taught us anything, we live in a global society. I mean, the major threats are global, but the action so much takes place locally, and we think in systems. We really got to lift up. I would ask everyone to think in systems and to support the organizations, or help encourage others to think in broader systems as opposed to just what's right in front of us. Because funding and energy for just today's problem is not going to solve the problems that are threatening human health. We've got to invest. And we need to be investing during the non-emergent times to help prevent and be prepared going forward, for sure.
That's great. I often find too that the local work actually gives you the hope and confidence that allows you to fund the global work that is, often in public policy or larger scale, or you can't see it. You can't go meet the recipients, and so. Philanthropy is about the love of humanity, and it's important for us to connect, right, with the recipients of the work, and that's often available in a local community. So it'll be interesting for you to be with the governors and co-chairing today. But let's see, I saw that we have friends from the Cargill Foundation. I've actually worked with a couple of folks from there during my times at the philanthropy workshop. So the question, maybe you can see it, Judy, too, but the weaponizing of the public health engagement, especially in the United States, has had a huge impact on CDC infection and mortality rates. Do you see a time of reckoning when this issue will be addressed and where such efforts to discredit science will end? Ooh, big, political question. Thank you, Bishop.
I mean, that's a terrific question. It's well stated. This is one of our greatest challenges, is to rebuild trust and to engage the public in a way that they understand science and the value of science, and trust public health officials. I mean, we've lost trust in government. It's been tragic what's happened to our public health officials. Many of them are, colleagues and friends of mine, and stories have been horrific. I believe we talk about action. This is a call to action, right? And this is one, though, that we need almost a movement in our country and around the world to revitalize this. I go back. It makes me wonder, though, in terms of public health, what are we teaching children, right? Let's start with the children. I think our kids need a fundamental understanding of some of the basics of public health and why when let me back up. I mean, all these children right now have lived through this pandemic. They've been virtual for their learning. What an incredible teaching moment for children, and then adults, obviously, as well. But I think we need more of a community support for public health. And I think there are a lot of people that do support public health, but they're the silent majority, and we hear from the vocal minority, and that's what takes the headlines. And then that the anger and the pushback that we've seen, again, is so tragic. Personally, I'd like to see like an X Prize for public health. I think we ought to flip this. I like to flip things 180. If I've got a problem, what's the other side of that? Instead of all the negative, we really need to lift up the incredible positive. And I will tell you something, when I was state health officer here in Indiana, public health belongs to all of us. You may have public health officials, but it's there for the public good, and all of us should care about it and be supportive.
Yeah, I think that's really well said. I mean, I'm thinking about, I have 2 high school kids, and I serve on the board of vote.org, and we're always saying, well, we need more civics, but we do have a government program, and we do have, US history is taught. But it's interesting that you bring up children, because it makes me think that I think so many people think, oh, the career progression is, do I want to be a doctor or a nurse? Do I want to be on the front lines? And public health is such an important piece that we need to frame it, as a larger, place where a larger industry that people could enter. And it's encouraging to see more people in public health. Paul Farmer was one of our speakers yesterday, and he described the U.S. being unprepared to deal with the pandemic, and really said this is a moment where we need to ensure that we are more resilient. And it is a moment now for us to reflect and think about what we did. He said so poorly. I'm going to try and put that in a more positive light. So we need to invest in public health, and we need to take care of the most vulnerable among us. He says for years we've been divesting in the public good and in healthcare and public health funding, and it's time to redefine the public contract, the social contract. So I'm just curious, are there specific things that you might have us pay attention to as we think about what is the social contract and its relationship to public health? And like, could we vote differently? Should we be paying attention to local officials? And how do we follow? I mean, we were talking earlier about our local, here in California, my local health official, Sarah Cody, and I think what she did was transformative, and I'm incredibly inspired by her courage. And how do I highlight her to, the young people and the people in our community to say, hey, we have a real leader who acted urgently and saved lives. So I'm just curious what you think about the call to action around public health. And with that, I'm going to also just encourage our online audience. Bishop asked a great question. Please jump in. We've got about 7 more minutes. So happy to answer any more questions online.
Well, so first of all, Dr. Sarah Cody is one of my heroes. And there are many, many heroes in the story of the pandemic and in the story of public health. And we do need to be lifting them and shining a light on them so that they're role models for everyone, not just children, for sure. But you said something really important. We all live in local communities. You've got county commissioners, you've got local, elected officials. We all live, in a state, and then obviously the country. But folks don't have I think fundamentally folks don't always understand how public health is structured. So here in the United States, as an example, we've got counties that the county commissioners are the ones that are authorizing whether or not that county health department gets funding, the local funding. They're authorizing whether or not federal funding will even be permitted, whether they'll accept the funding or accept funding from the states. Mm-hmm. And so there's a lot of power in the elected officials. And I think the citizens should know what they're thinking and what they're supporting or not, because they need to hear from every citizen. So pay attention to what's happening both locally with your health departments as well as at your state level, and then of course nationally.
Yep, I think that's we all became much more aware of the power of the local community and officials. Being in San Francisco yesterday, you have to wear a mask indoors. Here in Palo Alto area, that's not required. So even in a short drive, you're seeing the power of local officials and the decisions that they make. Another topic that we discussed was the intersectionality of climate change with public health. And last night, the future of water was a discussion about the intersectionality of climate change and health, access to clean water, and how that is changing, how, in more rural areas, access to clean water, which is one of the determinants of your healthiness and vibrancy as an individual and community, is at risk. So how do you think about climate change? And I know that the CDC has been part of sort of some security issues over time. And certainly when people don't feel secure or have to flee because of a hurricane or a fire, that's when the CDC or the public health officials get involved. So would you just speak to the intersectionality with climate change?
So I think many listening in will know that just recently there's been a lot of folks voicing how climate change is a public health issue. And so squarely it's a public health issue because it first of all, it's impacting, I think studies are coming out now, 85% of the world's population, probably more than that, are already being impacted by climate change. And it's so fundamental. It's water sources, as you mentioned. It's the threats as wildfires that you've had in California, right? The threats to life itself and the destruction, the hurricanes, that are becoming more intense, all of those weather events. But you also have then the droughts. We've got fundamentally food sources. I mean, the very basic needs are already impacting folks around the world. There are certain countries that don't have enough food because of the effects of climate change and the inability to grow food like once had been. It also comes down to public policy, and certainly public health gets involved in many things. But if we think about social determinants of health and housing, and if folks are living close to water where there's going to be flooding, what are we doing proactively in city planning? What are you doing proactively at each? And this comes down to each local community. What are the building codes, right? Are you forecasting the threats that climate change is going to be bringing, and what actions are you taking now rather than the full devastation on the backside? So there's a lot to unpack. And then the other thing that we've been through this pandemic, but climate change globally is creating the environment for more infectious diseases to spread more widely. Our risk of another pandemic is great because of climate change, much greater than it had been in centuries in the past. And we're seeing diseases now that have never been seen in certain parts of the world. And we thought those were tropical diseases. Not anymore. They've moved north because of climate change, as an example. So it goes on and on.
It does go on. And I wanted to say World Affairs is doing something called Rising Waters, which speaks to this. And there may be some actions that could be taken there. I'm personally involved with an organization in Santa Cruz, and we're working with the city on a plan to restore the coastline. And it's called Save the Waves. It's a small group, but we're working around the globe to create places where there are not only surf breaks that people can enjoy, but fisheries that are healthy and safety, and hotspots, ecological hotspots around the world that are safe for everyone to enjoy. Philip Yun has chimed in and asked, what are the two most important takeaways that you would share with us, Judy, as a way to round things out? So if you could close with that, and then we'll say thank you, and a bit of regret that Chet wasn't here to chime in on the conversation. So,
well, I would say a big takeaway is we've got to support global health security, and we're all in this together, is what I would say. And then the second is, everyone lift up and think systems, and then how can you help move that system to a better place to improve the system? And we all can take action. Everybody has an opportunity to be part of the solution.
Great. Well, thank you so much, Judy. We look forward to seeing you. Who knows, maybe the governors will be covered. The summit that you're co-chairing will be covered locally, and we'll get to nationally, and we'll get to see more of what the CDC Foundation is all about. And a thank you to there we get our cartoon, right? I love this graphic artist idea, and encourage folks to look at the blog that Samara has been creating. These graphics are a really fun way to capture some of the ideas and urgency to act. So hopefully you all have been hopefully we've achieved our goal of providing you with insights making you feel that you're part of a community and inspiring you to act. And so with appreciation for Judy and Chet, and as well, I just want to do a shout out to the Global Philanthropy team. Megan, thanks for getting us organized. Mara, thank you for getting everything going. And Philip, thank you to your entire team for making the Global Philanthropy Forum happen. And thank you all in the audience. We had many of you staying online with us all through 45 minutes. I know you're all a little zoomed out, and I appreciate the opportunity to be with you for 45 minutes today, and look forward to hearing more and ending on a high note with Samantha Power later today. Thanks.